Hi, I'm Melissa. This is Teal. And we're just going to walk through drawing up, dosing, and then injecting your weight loss medication. So this is an example of how to do that.
So we're going to start with our supplies here that come in your package. So we have the vial of medication, an insulin syringe, and then our alcohol swabs. So you're going to want to do this on a clean surface. I'm putting on gloves because she is my patient, but you don't have to do this at home.
Because you're your own patient?
Yes. So what you're going to do is there's this little silver tab on the vial. You're going to peel that off. That's garbage now. And then take your alcohol swab, open it up, clean off this little rubber stopper on the top. And then you're going to take your syringe. There's two caps, one's over the needle and one is over the plunger. So you're going to take this plunger one off, the shorter one off first. And then you're going to take the other side off to expose the needle. Pull back your syringe to the equivalent to your dose that you're going to be injecting. So in this case, it's 15, but you would pull it back to whatever the dose is. So it looks like that. So if it's 10, you do it to 10. If it's 30, do it to 30. Put this syringe directly into the vial. And you want to push that air into the vial. And that is so that when you get to the end, it's not too difficult to pull out the fluid. And then turn it upside down and pull the medication out to the dose, which is 15. And you can pull it a little extra and then push it back, push the air back in so that it's just the liquid in there. And you want to make sure the liquid goes in there. As you get down in the vial, sometimes the needle goes past the liquid, so you can pull it out a little bit so there's less needle in there to get that last amount of liquid out. So we've got the dose ready to go, and I'll show you what it looks like. So that top black line is in line with the 15. Now what Melissa's going to do is clean off where she's going to give her shot.
Right here.
And then she's going to take the syringe, just at a 90-degree angle, put it in like a dart into the skin, and then push, and then you take it out. And it's done.
Easy peasy.
Yeah.
Thanks.
And then if you don't put this other cap back on, the small cap, then you know, like if you set it down on the counter, the cap is off, you know that it's used. If you put this back on, it can be confusing because you can't tell if it's used or not.
Good point.
You can put this in an empty laundry detergent container. If you're in Minnesota, that is legal to do. You just tape the top when you're gonna, you can throw it in the garbage, tape the top, write sharps on there, and you can throw it in a regular garbage, or you can bring it to a sharps disposal place like with the city. So that's it. Do that again in a week and you're good to go.
All right.
Did it hurt?
Happy weight loss. No, not at all. Didn't hurt at all.
All right. Yes. Happy weight loss.